Hello, everyone. We are Group 6. I am Lauren. I will be a clinician, and the remaining members are Claire, who will be a clinician, Sky, who will also be a clinician, and Q, who will be the client for this evaluation. So for this motor evaluation, we will be sanitizing our hands and putting on our gloves. So, hi, Q. How are you today?
Hi, Lauren. I'm okay. How are you?
I'm good. Thank you. So can you tell me why you're here today? What brings you in?
So I've just been having some problems with producing sounds that I normally would be able to produce.
Okay, I understand that can be pretty frustrating. So today we will be completing a motor speech evaluation. Are you familiar with what that is?
A little.
Okay, all right. So a motor speech evaluation just kind of helps us to understand how your brain and muscles are working together to produce the speech. So we're looking at things like how your lips, your tongue, and your jaw are moving, and just to see how well you can control your breathing while speaking as well. This will let us see the muscle strength, the coordination, and the movement. So if at any point you feel discomfort, please let me know because this should not hurt. Okay?
Alrighty, I'm ready.
All right, here we go. Okay, so first off, I just want you to look at me straight on, checking your facial symmetry right now. Everything looks good. Now, slowly, if you could look to one side. Perfect. Now back over to the other. Awesome. The lips and eyes, everything looks symmetrical, so that's great. Can you open and close your jaw for me slowly? Perfect. Everything feels good, no discomfort.
No discomfort.
Awesome. Okay, great. So next, I'm going to want you to move your jaw from side to side like so. Good. Anything out of the ordinary there? Everything feels okay?
No, everything's good.
Okay, next, I want you to smile. Good, everything looks great. And then I want you to pucker your lips for me, like you're giving a kiss. Perfect. Now, if you could say ooh,
Ooh,
ee,
ee,
and then just a couple times really quickly, ooh-ee, ooh-ee.
ooey, ooey.
Perfect. Everything looks great. Next, I want you to stick your tongue out as far as you can. Perfect. Now move it up towards your nose. Now side to side. Awesome. Everything looks good. Next, I want you to puff your cheeks out and hold that for me. Awesome. Now apply a little bit of pressure right here without letting the air out. Good. Everything feels good?
Yes.
Awesome. Cool. So now I want you to open your mouth and say ah. And what I'm going to do is I'm going to take a flashlight and I'm just going to take a look inside and peek around, okay?
Okay.
All right.
Ah.
All right, awesome. Everything looks good. And next, I want you to make a sharp cough for me. Perfect. All right. Thank you, Q. I'm gonna send you on over to Claire.
Hi there, Q. How are you doing today?
Hey, Claire, I'm doing good. How are you?
I'm doing well. So we're on my section now, and it's called the phonatory respiratory section. So basically, like clinician Lauren already said, this is just going to help me see how your speech muscles are working and if there's anything going on that's affecting your speech. So if you don't mind, can you just take a deep breath for me? Perfect. And now I want you to do that same thing and say, ah, as long and as clearly as you can.
Ah.
Perfect. All right. Can you do that for me one more time?
Ah.
Great. And just one more time for me.
Ah.
All right. Thank you. And now I want you to take a deep breath and say, ooh, as long as you can, just like we did before.
Ooh.
Perfect. All righty. Next, I want you to take a deep breath and say pa, 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 as long and as fast as you can.
Pa, 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 pa.
Great. Um, Now I want you to, we're going to do a couple of different trials here. So first I want you to do the same one as before, pa, 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 just a couple times.
Pa, 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 pa.
Good. Now ta, 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 ta.
Ta, 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 ta.
Good. And then ka, 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 ka.
Ka, 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 ka.
Great. And now we're going to put it all together, and I want you to say putaka, putaka, putaka as many times as you can.
Putaka, 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 putaka.
All right, thank you. Let me see. All righty, moving on. Now I want you to do some other things. Listen and do everything as completely and as well as you can. Are you ready, Q?
Yes.
All right, perfect. Stick out your tongue. Great. Show me how you would blow out a match. Show me your teeth. Great. Round your lips. Touch your nose with the tip of your tongue. Good. Now bite your lower lip. Great. Show me how to whistle. Good. You feeling okay? No pain so far?
I'm feeling good.
All right. Now lick your lips all around. Excellent. Clear your throat and move your tongue in and out. Okay. Click your teeth together one time. Okay. Show me how you smile. Great. Chatter your teeth if you were cold, as if you were cold. Okay, excellent. Touch your chin with the tip of your tongue. Great. Show me how you cough. Now puff out your cheeks. Alrighty. Wiggle your tongue from side to side. And alternately pucker and smile. All right. Wonderful. Thank you so much, Q. That concludes my portion. You did great.
Thank you.
Hi, Q.
Hey,
How are you doing today?
I'm well. How are you?
I am good. Well, my part of the exam deals with the oral verbal apraxia. So that condition is apraxia of speech is a condition that makes it hard for your brain to tell your mouth how to move when you want to talk. So during this part of the exam, I'll ask you some specific words or phrases. This helps us to understand if you're having trouble planning the movements needed for speech. It's important because it can show us where you might need extra help.
Okay.
All right, so I'm going to say a word and I want you to say it after me. You ready?
Ready.
Okay. Slowpoke.
Slowpoke.
Conference.
What was the word?
Conference.
Conference.
Good job. Tahiti.
Tahiti.
Dressmaker.
Dressmaker.
Kindergarten.
Kindergarten.
Condominium.
Condominium.
Good job. So I want you to really listen because I'm going to say three or four words, and you have to say them. Baseball, baseball cap.
Baseball, baseball cap.
Good job. Fan, fancy, fantastic, fashionable.
Fan, fancy, fantastic, fashionable.
Glow, glowing, glistening, glamorously.
Glow, glowing, glistening, glamorously.
Good. Riddle, ridicule, ridiculous.
Red, riddle, ridicule, ridiculous.
Can you say red for me?
Red,
Okay. All right. Mime.
Mime.
George.
George.
Pipe.
Pipe.
Babe.
Babe.
Dude.
Dude.
Tent.
Tent.
Nan.
Nan.
Good. Now I'm going to say some sentences, and I'd like for you to repeat them. The beautiful girl was dancing.
The beautiful girl was dancing.
Open this birthday present first.
Open this birthday present first.
The stranger walked into the store.
The stranger walked into the store.
The bird watcher saw a Norwegian blue parrot.
The bird watcher saw a Norwegian blue parrot.
Good. All right. Can you count from 1 to 20 for me?
Sure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Good. Can you count backwards for me from 20 to 1?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Great. Great job. All right. Next, I am going to show you a picture. I would like for you to tell me what's happening in the picture. We use the cookie theft picture because it helps to us to see how you express yourself through speaking and how your brain processes what you want to say. Um, the image shows a scene with a child trying to steal cookies, which gives you a chance to tell the story.
Okay. So what I see is the mom in the kitchen washing dishes, and she's so focused on the dishes. She has the water overflowing. There are kids stealing cookies out of the cookie jar, and the
Mhm.
little boy is about to fall over, and I guess that's his sister's helping him steal the cookies while the mom isn't looking.
All right. Are you finished?
Yes, I'm done.
All right, thank you so much. So we have one more thing to do. So next, I'll be conducting a connected speech sample from you. Do you see the passage?
Yes, I'm ready to read.
All right, go.
So, grandfather, you wish to know about my grandfather. Well, he is nearly 93 years old, yet he still thinks as swiftly as ever. He dresses himself in an old black frock coat, usually several buttons missing. A long beard clings to his chin, giving those who observe him a pronounced feeling of the utmost respect. When he speaks, his voice is just a bit cracked and quivers a bit. Twice each day he plays skillfully and with zest upon a small organ, except in the winter when the snow or ice prevents. He slowly takes a short walk in the open air each day. We have often urged him to walk more and smoke less, but he always answers, banana oil. Grandfather likes to be modern in his language.
Good job. Thank you so much for your time, Q.
All right, so now I will explain, compare and contrast the difference between a motor speech exam and an oral mech exam. So, a motor speech exam and an oral mech exam are both important components in assessment of speech and swallowing disorders, but the focus on different aspects of motor function is relevant to the speech pathologist. So, for the motor speech exam, the focus is on the overall muscle strength, coordination, tone, and reflexes of the body and gross motor movements and fine motor movements. The purpose of this is to check for neuromuscular issues like weakness or spasticity. During this motor speech assessment, you assess the overall motor control and how it may impact communication or feeding. So for the oral mech exam, you focus specifically on structure and function of the speech and swallowing mechanism, like the lips, tongue, jaw, and the soft palate. The purpose of this is to assess the oral strength, range of motion, symmetry, coordination, and sensation for the speech production and swallowing. Doing this, you can check for abnormalities, structurals, like maybe a cleft palate or something that may prevent the person from being able to speak clearly. All of this is very important. The key differences is the motor exam um, is not is the whole body motor control, and the oral mech focus on oral and facial structures. The overlap and some of the similarities is both exams may identify motor-based disorders such as dysarthria or weakness or poor motor control, which impacts speech and swallowing. And that concludes our presentation.